Hey everybody, it's Dr. Adam Matthews, and I am here with Elizabeth Pugliese. She is a licensed clinical mental health counselor associate and a licensed clinical addiction specialist associate with us at Matthews Counseling. She's one of our newest therapists. You've been here a couple months, right?
Yeah, since June. Yep.
Awesome. Got started in the heat of the summer. And we just like when we have new therapists come on board, we like to just give you some background on them, have them just answer some questions, just so you can get to know the people that you're find your fit as a therapist. Like we know that that's the biggest challenge sometimes is finding a good fit as a therapist. So we want to make sure to give you as much information about our therapist up front as we possibly can. So Elizabeth, welcome. I'm so glad you're here. Um, the question we always start off with is
Mhm.
just what you wanted to be when, as a kid, like what you wanted to be when you grew up.
Oh yeah.
Yes.
Definitely professional soccer players on the list. Lawyer, doctor, vet. I loved animals. Um, but yeah, I obviously worked my way up to therapy. But
Yes.
yeah,
Soccer
the
player. Who was?
typical kid stuff.
Yeah,
Uh-huh.
like, but that's a professional soccer player. That's the other one's kind of maybe kids cycle through a little bit. But
Right.
who was your favorite soccer player? Did you have like people?
Yeah, I was really inspired by Mia Hamm, of course. But I played since I was 5, so I loved soccer and just kind of sports in general. And so but yeah, and then high school hit and some reality set in. So
As my basketball dreams at
right.
5'11", I got crushed in high school. Yeah. So do you still play soccer now? Do you
I
still?
actually haven't in years. I did play so after high school, I started doing some track and running, and then um in college I played a couple of pickup games like on a co-ed team just recreationally, but yeah, I would love to get back into it one day, but definitely not as good as I used to be. So
Well, so how did you go from wannabe soccer player, wannabe veterinarian to therapy? What was that kind of transition like for you?
yeah, so I was definitely uh a bit of a bookworm kind of growing up and loved I think it was in high school, started this one project and just learned a lot about the brain and how it works, and I was really interested in it and just realized just how vast, and we've only really scratched the surface of how humans kind of function and, and operate, and just the differences and uniqueness of people as well, and how that works. And so I was just really interested in how kind of mental health works, and especially how the brain can be influenced by things and also change and heal, and how we can um, have some kind of control over that as well.
Yeah.
And just the kind of balancing the influences of things that happen around us, and how we can use that and shape how we want to be. And so I was just really interested in that, and then just wanting to kind of give back to others as well and just kind of support others. I did help, as a camp counselor. I taught martial arts with kids and stuff, and just kind of liked being in a supportive role as well growing up. So I feel like therapy is the best of both worlds. I get to work with people,
Yeah.
give back to others, and also in an area that I'm just interested in. So I feel like it gives me
Yeah,
best of both worlds.
you kind of answered the question that I was
Yeah.
gonna ask, like, because if you're interested in the brain, you didn't go the psychology route, you went more the therapy route.
Right.
And you kind of answered that. Is that the getting to work with other people and that's in
Yeah.
setting?
Yeah, and I feel like it having like the a certain foundation of information that I'm interested in helps with that. And it can kind of drive that passion too. It's funny you say that though, because I started my undergraduate career in with neuroscience. I think it was my sophomore or junior year. I switched sophomore year to psychology, um, because that avenue just is more likely to land you in therapy. And so um, just with the program and how it was designed. But I still like those sciencey kind of classes and just how like the brain functions in general. So I feel like that's been helpful for me as a therapist as well.
So, yeah, so that it kind of allows you kind of to be in have a lot of different interests. That's one of the things I like about therapy too, is that it
Mhm.
allows us to kind of have to have learning in a bunch of different areas to kind of bring all of that together and
Yeah.
help people.
Yeah, it definitely feels well rounded.
Yeah, awesome. So where'd you go to college? Kind of where'd you do your grad work at?
Yeah.
What were those experiences?
Um, so I grew up in the Boston area, but I went to college in Vermont. And so Burlington University of Vermont in Burlington. Loved it. Beautiful campus, great program. Probably one of the best decisions I've made. And then I love warmer weather. So after 9 months of, negative 40 degrees, the mountains are beautiful. It was amazing. I'll never regret that choice. Yeah, I moved down here,
Yeah.
tried something new. A lot of our friends, kind of went all over the place. And so I want to go somewhere new. And I just kind of chose this area in the Triangle, North Carolina. Took some time off, try to get settled because I'd never been here before. I don't really know anyone down here when
Wow.
I came here. And so I just want to get some time, get a job, get settled, buy a car, and then
Yeah.
got to grad school. And I did an online program at Central, so North Carolina Central University. They have a wonderful online program. All of my searches of schools in the area, that one just kept coming up as having the course material that was just really good for therapy. And so I went with that program, and it was great. Allowed me to kind of work and go to school as well, because it was designed for working professionals. And so it was a really good fit for me, and I really love the program, and glad I had the 2 years off as well. I needed a
Yeah,
break.
that's such a good route. That's to me, that's also well-rounded as well, right? Because you get that experience, you get settled, and
Mhm,
it's such an adventure too, moving to a place where you don't know anybody, right?
mhm.
Like that says something too. Like just starting off in a place, nothing, and kind of making something out of that. I think that's fantastic. So as you're kind of we're learning about therapy, right? You said you kind of have started in kind of the neuroscience area,
Mhm.
moving into the field, were there any kind of like things you thought were true about therapy that it turned out not to be true? Like that we talk a lot about like myths of therapy that we try
Mm.
to debunk for people, but anything for you that kind of your ideas of therapy in the beginning and then how they've kind of shifted now?
Yeah, I think there's a lot. I think I'm assuming a lot of therapists can relate to this. Like when you first start out, kind of learning like how to do therapy. Like there's different, therapeutic techniques. There's stuff you can specialize in, and there's still stuff like that I'm interested in. And so one of the biggest things, and it's not that I didn't know it, but it was more of like how important it was, or just like, we don't really give advice. Like we're not really telling people what to do, and it's really kind of client directed, and it kind of even through the internship and my clinical training, kind of just having an understanding of really just being there. So, which of course, like that's kind of why I went into this line of work anyway. But um, really, really just having it be more like learning the different ways of how to draw out
Mm.
those tools and things that people want from within, because they have those resources, are able to, and then knowing sometimes when maybe to have more direction and more structure in a session as well, because everyone is different and some people do have different needs for that. And so just kind of learning like when to balance that out,
Yeah.
the structure and the direction that you provide versus for the most part they're kind of leading session. So
I think, and because of that, sometimes people have a misconception. It like the non-advice part can feel very
right, it's like I came here for help, tell me what to
right.
do. Yeah,
And because it is true. Like like as therapists, we don't really give advice, so we don't tell people what to do.
right.
The difference is that that can feel unstructured sometimes to people, but the truth is there's a lot of structure behind
Yes.
that kind of non-directive approach,
Yeah.
which can be hard. Which I think people it's hard if you don't know that to kind of go into a session where a therapist is asking you what you think.
Right.
It's hard to know that sometimes, but I think that is
Yeah.
a big myth or a big challenge of therapy. What do you feel like are when doing therapy with you, right? What has kind of come? I talk a lot with all our therapists about
Mhm.
finding your own voice in therapy, right? And like
Mm.
as as you said, every client is different, or every therapist is different as well, and has different approaches. So, kind of the what does your voice look like in therapy? What is it? What's the way that you um, kind of approach a session that would be maybe people could expect across no
Yeah.
matter what session, no matter what, when they pop in or who pops in, you're going to be kind of, it's going to feel this way.
Right. Yeah. So I always try to leave space for what the client wants to bring, right? So life happens. Sometimes we might be working on a certain goal of theirs, and then something comes in, and like, I gotta talk about this. So we leave it that, right? And so for me, I try, on day one, kind of explaining like what my role in therapy might be, and that might happen again depending on how things change, right? Like if they're asking more for advice, I might kind of step back and just explain like how I can support them in that way that isn't going to lead to some type of dependency or something. And so, but also really just kind of giving space and trying to create an environment where they feel safe enough and comfortable to talk about stuff that they're coming to therapy for. And it doesn't always happen the first session. Some people are very open, and some people, they're going to test the waters naturally, right?
Right.
And so trying to give them space and then provide some structure kind of afterwards, like what they're wanting to bring and how do you want to move forward from here, right? And sometimes it is just they just need a day to vent and just to get it off their chest and provide a listening ear for that. And so I try to kind of gauge when's the time to do that, and when is the time to process more what's going on.
Yeah, that's great. I think that the creating space idea is really important, and how you provide that safety for clients to do what needs to happen in those moments. But like how you create that space becomes really valuable to people. And again, not the easiest thing, but like
Right.
it's
It's definitely an intentional effort and presence. Yeah. That I couldn't really quite wrap my mind about until I started doing it in the training. Yeah.
yeah,
Like, yeah.
yeah, that's kind of changed, that shifted a little bit as therapy, more and more therapy is online, and
Mhm.
how you do that well. But that's kind of that foundational place of having people say like, we can trust that this is a safe space, right? To do whatever happens there. I think that's really good. So just for informationally, who do you see? What kind of populations you work with? What's
Mhm. Yeah.
the
So I mostly work with adults, individual clients. And then, if appropriate, once in a while having other supports come in if that's needed, then absolutely happy to do that. I think involving supports is a huge piece of therapy as well. Um, but for the most part, working with adults, usually have experienced some type of trauma, sometimes compound trauma. So like years of different stuff, different types of trauma. And then usually with some type of mood experience like depression or anxiety as well. And then also I've worked with folks who have had a variety of substance use disorders or um, alcohol or drug use as well.
Yeah, perfect. Well, okay, so shifting gears a little bit.
Mhm.
What are give me a couple of guilty pleasures, movies, TVs, books. Like, what are the things that, like, if you're just gonna kind of relax and let it all go, what's happening there? What
I
are they?
do um I do like to eat, so I like to cook.
Awesome.
Like going out to eat, exploring new places, and then definitely like to, watch TV or sit outside if I can, if it's not too humid. I like the heat, but not the humidity.
Yeah.
And starting to get back into reading. I used to love to read, just it kind of escaped out of my schedule. And so just trying to read more as well.
That's the grad school curse as well, right? Once
Oh
you
yeah, it's all textbooks. Yeah, and
what's the
life
last
gets
what's the
busy.
last
So
thing you cooked? What's the last thing you cooked?
ooh. I made some mahi fish last night. And then my partner made the other half of my dinner. So very
Awesome. That's good.
supportive in that nature.
You're working together to do that.
We do, yeah.
That's awesome.
Yeah.
All right. Well, Elizabeth, thank you for your time. Just really appreciate you and the work that you're doing. If you want to schedule with Elizabeth, you can request an appointment online on our website, or you can call our care coordinator at 918, saying the wrong number, 919-587-8018. Online, matthewscounseling.net, or um, give our office a call, 919-587-8018. All right. Well, have a great day,
Thanks.
Elizabeth, and we'll talk soon.